or out on a road bike. If you're a road biker or a mountain biker, Maryland has incredible territory to offer. So Jenny and I were just talking about that earlier. So thank you very much, and I'll join others in welcoming you here to this fabulous place. You are surrounded by excellence, and that's one of the most exciting things about Johns Hopkins. So I'm here to share, along with the myriad of other resources you've heard about today, a place where you can receive biostatistical and epidemiologic resources. So we are the BEAD Core, and our mission is really to help you advance your career and advance discovery, research innovation. Along the right-hand side of the slide, you see the types of research support services that we provide. We like to get under the hood early with you, so please come early, request research support early. We like to talk about research aims and then think about what study design is most appropriate to answer your research questions, and then think about the statistical analytic plan that then follows that study design and those aims. If you come to us very late in the game, we may say, but you really don't have a testable hypothesis. Sure, I can write you a stat plan, but you're, so come early. And the other piece that we help with, about 35% of the research support that we provide is biostatistical analyses. So for example, if you come to us with data already and you're looking to write a paper, we can help run those analyses. We run on a policy of everybody working to the top of their license, so you should be writing that paper, writing that introduction and discussion, and we can be running your data for you while you're writing, and then we work together to ensure that that we're testing the hypothesis correctly and that the inferences are sound and translatable. We also have a qualitative research support service line, so there's been an increasing need and desire for qualitative research. You see that in NIH NOFOs, and everywhere we look, trying to bring the patient narrative to the fore, community voices, so we provide a specific service line for that. We also support grant submissions, scientific manuscripts. So for example, I already mentioned we'll help with the statistical analysis for your paper. We can write a statistical plan for your grant submission, for an R01, for a K23. And we can run a power and effect size calculation for that submission as well. I'll write a letter of support for you from the BEAD Core, and that often gets accolades from reviewers saying it's awesome that Hopkins has a core like the BEAD Core that can provide research support. We also provide support with data collection instruments. So you heard earlier that we have a REDCap hub that's run by Scott Carey of the ICTR. The School of Public Health also has a REDCap hub. Scott Carey often triages to us to help build those REDCaps. So if you're doing primary data collection or if you're extracting data from Epic and then also collecting primary data collection, we can help with those. We also do audio-computer self-assisted interviewers, CAPIs, all sorts of different. I use those in my research. And then throughout the year, we provide research training and education workshops, and so you'll see announcements for those. I'm always here on behalf of an incredible team, so I'm just representing this wonderful team. They are here to help support you. We work as a village, so we have lead faculty members that you see here on the left-hand side that are doctoral trained faculty members that will be your primary liaison and work with you as collaborators. And then we have a host of an incredible analyst team that then help to come and run the analyses and support, for example, those power and effect size calculations. Just a brief history of time of the BEAD Core. We really started to formalize in 2010, and then we have a subscription model for departments, so we've brought multiple different departments on board: pediatrics, medicine, GYN-OB, the SKCCC and the ICTR have supported us for a patient-reported outcomes service line specifically, and we support PIMCOs. You heard from Mark about Precision Medicine Centers of Excellence, so we support those. There is an ICTR team that helps wrangle the data, the EPIC data, bring it into a format, and then we, like a baton pass, help to support then the analyses of those data to make them meaningful. We brought ACCM on board in 2021, then dermatology and orthopedic surgery just recently came on board this year. Our policies are derived from a set of core values: respect for intellectual curiosity, really integrity in our work ethic and science, and dedication to innovation. We like to think of ourselves as a small business within an academic environment and sort of capitalizing on both of those. So in that sense, we really try to work with professionalism and clear and consistent communication. And then ensuring equity, that we celebrate multiple disciplines and training, and that we ensure that our services are accessible to all. We have a few policies. I already mentioned one of them, which is come to us early. We do not take a deadline of less than 15 business days. It's not good for our scientific integrity, not good for us, not good for you. So come early. In subscribing departments, so you see those listed above, you receive a certain number of hours. I'll mention that in the next slide. And if our contribution as a lead faculty member, for example, rises to the level of authorship, then we ask to be co-authors. Again, a collaborative model where we're together. We have skin in the game, you have skin in the game, and we're looking to generate an excellent scholarly product. So what do subscribing departmental faculty receive? They receive a minimum of 40 hours, with 20 of those hours earmarked for grant submissions specifically to catalyze those grant submissions. And then 20 hours per trainee. So if you have 5 trainees, that's 5 times 20, 100 hours plus your own hours. You can see it quickly multiplies. Multiple investigators can pool hours, and they often do. And your projects can extend over multiple years. We know that happens. And then if additional hours are required, we do move to a direct fee for service model, and anybody can come to us to do direct fee for service work. To get research support, you simply have to write beadcore@jimmy.edu. It's as simple as that. You'll receive an email back that asks you to fill out a brief intake form that helps us understand what your needs are and describes the area of research that you're in. Behind the scenes, we then triage to the appropriate lead faculty member on our team, and we ask for a 1-hour consultation. That's what we'll sit down with you and talk about what is it that you perceive your needs to be and what is your area of research. And then we're off and running as a collaborative team. And once the work is completed, the scholarly products are submitted, we then will send you an invoice. Often, if you're in a subscribing department, that's a zero balance, but we want to be transparent about the value you're receiving for the work. So we are the BEAD Core at jimmy.edu. Simply write BEAD Core at jimmy.edu to receive research support. Thank you.